first of all, can anyone not hear me? Right. Yeah. Is that any better? Can you hear me now? Yeah, right. Could you stick your hand up if you can't hear me? Because I realise it's quite difficult if you're at the back or if you have got some hearing problems. So I will try my best to speak as loudly as I can. I would like to thank John and on behalf of Vasculitis UK for inviting me here this morning to tell you about some work that we have been undertaking for setting a research priority agenda for Vasculitis UK. Next slide, please. Now, for all of you in this room, it's really, really important, particularly if you belong to a membership and organisation, particularly fundraising, and we're getting money, to do some research. But it's really, really important for us to find out what either the membership or what patients, carers, people who live with their vasculitis every day, what are their research priorities, so that we're actually using money appropriately. So therefore, Vasculitis UK is developing a research strategy, and they wish to establish research priorities. Therefore, we wanted to survey the membership of Vasculitis UK and other interested parties. So what we did was, we developed an online survey, but we're also aware that not everyone has access to the internet. Well, while maybe a lot of us do, there are still some people who don't have access to the internet. So as not to disadvantage this group, we also developed a postal survey, which was posted out to the membership of Vasculitis UK. Can I ask, has anyone in the audience participated in the survey? Good. I have as well. Right, but yeah,
Did you
right, so that's really good. The message is getting through. Right. So what I want to tell you about this morning is to tell you what some of the preliminary results that we've actually been analysing as a result of this survey. So basically, we sent out an electronic link, and we also sent out a postal questionnaire. However, there was a note to say, please don't fill in both, because obviously we just want you to fill in either the questionnaire online, the survey online, or the postal questionnaire. And again, what we did was, we thought about what are all the possible research topics that we're interested in finding out. We don't know all the answers about vasculitis. We're really trying to find out answers to lots of research questions. So what we did was, we did a list of questions from 1 to 18, and you were asked to rank in order of what you thought was the most important research question to be answered, from 1 to 18. Next slide, please. So who partook in our survey? Well, we had 354 respondents. The age range was from 13 to 89, which is a very wide age group. The median age was 62 years. The gender, there were more females than males. I don't know if that's just because females are a bit better at filling things in, but we had 72% were female. And I'm glad to say we did have some males participate. We had 28% of males as well. Next slide, please. So what did all these people who answered the survey, were they patients, were they carers, what were they? Well, majority of them, roughly about 78%, were actually people with a type of vasculitis. Then we had roughly about 8% were carers. In other words, they were caring for somebody who had vasculitis. Small minority, about 5%, were actual parents. In other words, they were caring for children with vasculitis. We had a couple of doctors, not many. You see, we've only got 5 at the minute. But we do hope, we are going to repeat the survey at the British Society of Rheumatology in a week's time to capture many more doctors and nurses, because we have a big group there. And we're also going to be doing the survey at the Vasculitis conference in the next couple of days as well. So hopefully we will get many more respondents from doctors and nurses. There's a couple of nurses, one of which was myself. We had one physio, we had a couple of scientists, and we had a couple of researchers. But we hope to get the sort of allied health professionals. We'll have to get more responses from them within the next week. Next slide, please. So we also wanted to know did the respondents belong to any type of support group? It's often difficult to find out information about what membership the patients, what support groups do they belong to. Often very little information out there. Roughly 88% belong to Vasculitis UK. That's not surprising because we surveyed the membership of Vasculitis UK, so that's reassuring. But obviously there are other local support groups around that people also belong to. We've got the Lauren Curry Foundation, we've got the Vasculitis Foundation UK, which is an American association. We've got the Polymyalgia Rheumatica and giant cell arthritis support group, and we've got the Veterans Society. So we did manage to capture a range of respondents. Next slide, please. It's also important for us to find out what type of vasculitis that the respondents had. The majority, it was roughly about 70%, had granulomatous with polyangiitis. Not applicable was obviously those of us that either were carers, doctors, nurses, or scientists, or researchers. The next common one was eosinophilic granulomatous with polyangiitis. That was roughly about 16%. Then we had microscopic polyangiitis, following up a little bit less. Tachyarthritis arteritis. And we know that's not as common as some of the other vasculitis. But we still had some respondents who had tachyarthritis that were replying to our questionnaire. Giant cell arthritis, we didn't have quite as many there. It was roughly about 4%. Polyarthritis nodosa, not as common either. We did have a couple of respondents with IgA vasculitis, and then we had other different types of vasculitis, like renal vasculitis. Next slide, please. Now, this is the important slide. There is a copy of this slide in your pack, for those of you that might not be able to read it quite so well. And these really were, when we analysed the data, and when we looked at what did the respondents tell us were the most important priorities that we should be looking at to undertake research. Now, this is important because we're dealing with rare conditions, yeah? And it's often difficult to research rare conditions because you need a lot of patients. And the top one that came out was getting a diagnosis. In other words, how do I get my diagnosis, including tests? Now, I'm not surprised at that because often patients will tell us it's been really, really difficult to get a diagnosis. They've had lots of tests, seen lots of different doctors, nurses, or there's been a delay in getting a diagnosis. The other one is about new treatments. Yeah? Once you've got your diagnosis, it's really important for you to find out what new treatments are out there, or what research has been done into new treatments that can possibly help treat my condition. Then again, a bit like Richard talked earlier about the causes, including the genetic background. In other words, we all want to know if we've got something, particularly if it's rare. What caused it? Why did I get it? Then this came out as quite high, and I'm not surprised by this one because I spend a lot of my time educating other healthcare professionals. We thought it was really important that education of healthcare professionals, that they should know about rare conditions. Yeah? Because often I get told, oh, I've never met anyone that knows what this vasculitis is, or has even heard of it, or can even pronounce the name of the condition I've got. Yeah? Or often patients will say, well, I have to go and tell someone else about my condition, when actually, they do need some education. So, for my personal bias, which is education, I'm quite glad that's there. And then about clinical outcomes. In other words, what happens to you when you get vasculitis? What's the future going to hold for us? And then again, mechanism of disease. In other words, it's sort of linked to what causes it. What's going to happen to me as well? And again, access to therapies. You should be able to access new therapies around and not just be denied it. It's interesting because it's really important, particularly with clinical commissioning. If there are new therapies there and you're not responding to the treatment you're on, you need to be able to get access to them. And it's also important for us to be doing research into new therapies. There might be some new drugs out there that haven't been tried in vasculitis, so that's equally important. Disease assessments. again, we use lots of tools to assess how active your condition is. How do we monitor your condition? And it's important to know which are the right tools to be used, which are the best tools that we can use. And that's important, particularly if you've been you may have been looked after by someone who may not be a specialist, or you may not have access to some specialists. Psychological impact. And for patients, this is a huge topic. We try and help patients come to terms with their condition, but you have to be able to live and manage with it on a daily basis. And that's really, really hard. It's important that we also carry out research into that area. What's the best way to help you cope with your condition? What works for one person might not necessarily work, for the next person. Self-management, again, we know very little about what's the best techniques or the best way for patients with vasculitis to self-manage. We know a lot more in diseases like rheumatoid arthritis. So this is another one that's really important. What is the best thing to tell you how to manage your condition? We're all very different. Social impact, again, how does vasculitis impact on you, not just socially but financially? It impacts the whole of the family, impacts the whole of your life. And again, we know very little on that. We've got some data from the States, but we've got very little data from the UK on this particular topic. Again, role of rehabilitation. We've got evidence of case studies, but we've got very little research into what really works for different types of vasculitis. So again, another big area where we don't have a lot of research. And again, patient-reported outcome measures. You'll probably hear a bit more about these at the conference. We are starting to do research into patient-reported outcome measures because it's really important for us as clinicians, if we're looking after you, that we make sure that we've got what you think is important to be included in assessment tools that we use, not just what we think as clinicians. Something may be really important to you that we may not have acknowledged. Again, exercise. Often a difficult one. Patients often ask me, how much exercise should I do? When should I do it? And again, we've got very little research into this area as well. And again, I've talked a little bit earlier about financial impact. We have got some data from the States. We don't have any data from the UK about what the financial impact of having vasculitis has, not just on you, but the family and society. Again, the occurrence of vasculitis in populations, it is there, Richard. Richard just talked a lot about this morning about how common is this, who gets it. And again, health economics. You'll now see studies looking at health economics in lots of different conditions. So I think that again will become quite important. So all of these are important, but we were just asking you to rank as to what you thought were the most important for you. Next slide, please. We would be grateful. In your delegate pack, we have included, it's just one question, and there is a copy of that slide with the ranking orders on it. We just want you to give us maybe one line to say, do you think these priorities reflect what you think as individuals? Thank you.